This is COVID-19 after the lockdown, and we are joined on the program by 6th District Congressman Andy Barr. Congressman, I appreciate your time. Thank you very much. You know, when this pandemic hit us last March, formally, although it had been around for a little bit while, we weren't really prepared for the pandemic. How much have we learned in the last year, and how prepared are we if something like this comes along again?
Well, good to be on your show, Larry. Thanks so much. And I think we have learned quite a bit. I think it's a mixed bag whether or not we're ready for this in the future. And I say mixed bag because obviously we've learned a lot. We've learned that our strategic national stockpile was inadequate from a standpoint of personal protective equipment. We learned that our manufacturing base here at home was totally inadequate, that we were over-dependent on Asia and in particular China for personal protective equipment. Not only did the Communist Chinese Party cover up the origins of the pandemic, but then they weaponized the supply chain against us in terms of medical equipment, pharmaceuticals, and the like. We've learned from that, I believe, and there are a variety of bipartisan bills in the Congress to strengthen our domestic supply chain and our domestic manufacturing capability. I hope we learn from that and we some of the legislation to improve the situation on that front. I do worry, and I say it's a mixed bag because I do worry that we haven't learned. You know, when the Secretary of State goes to Anchorage and on our own soil allows the top member of the Politburo of the Chinese Communists to lecture us on how bad America is, when it was the Chinese Communist Party that was responsible for and covered up this pandemic, I don't think we've learned a lot. When the President of the United States yesterday, when asked whether or not he has raised the issue of the origins of the pandemic to the culprit, the President Xi of China, he said he hasn't even done it. That's like priority number one. Priority number one would be to confront the Chinese Communist Party. And then the President rejoins the World Health Organization with no reforms whatsoever, reversing President Trump's decision to pull out of the World Health Organization, a co-conspirator in the cover-up of COVID-19. So in some respects, I think we've learned. In other respects, we have not. There were some things that we did very, very well in response to the pandemic. Operation Warp Speed, for example, and the Paycheck Protection Program, which was really a lifeline. Other areas we just totally failed. Overzealous lockdowns and unemployment insurance that was mismanaged at the state level and just simply encouraged people to not go back to work. So some things we did well, some things we did not do well.
Congressman, I mean, I want to talk to you about the supply chain. I mean, that was one of the concerns early on. You talked about some of the things we've done well, some things we have not really learned. I mean, are we still overly reliant on international markets for healthcare supply chains, medicines, ingredients to create medicine? And is there any motivation in Washington, D.C. to correct that?
Yes, we are still over-reliant. And it's not just medical supplies. It's other parts of our industrial base that we're over-reliant. I mean, look at critical minerals. You know, most of all of the rare earth elements and critical minerals that actually go into our weapon systems that are procured by the Department of Defense for, you know, the F-35 and other sensitive weapon systems in our military, we source that from, of all places, China. And part of the problem is that we don't have a streamlined permitting process for mining here in the United States. That has got to change. That's why I introduced legislation as part of the China Task Force to decrease our dependence on rare earth elements and critical minerals. You know, we don't use coal for energy as much anymore, but we could use our coal miners to help our defense posture relative to China by decreasing our dependence on rare earth elements. There's a lot of rare earth elements, critical minerals that go into our national security that come from coal, and we need to think about that. So, and all the way around, we've got a lot of work to do on that in pharmaceuticals and medical equipment.
We're talking with Congressman Andy Barr here in the 6th District. Last segment, we're talking about vaccine hesitancy and the importance of the vaccine to reach herd immunity, which I think is something we should all be striving for. Do you believe that there's been the messaging around the vaccines and that's causing distrust among the people, because there are 20-25% of Americans out there, maybe even higher, according to some studies, that are hesitant or reluctant to trust that the vaccine is safe or that it's the right approach towards reaching herd immunity. Do you believe a lot of that mistrust is due to conflicting messages being passed along by health officials? President Trump, President Biden, both administrations. Do you believe that's been a problem?
I do believe it's been a problem. I believe and voted for Operation Warp Speed, which was a historic, unprecedented initiative to drive development and distribution of safe and effective vaccines. I believe in it because I voted for it. I voted for it. $13 billion that expedited the development and cut red tape at the FDA. I took my vaccines, my Pfizer vaccines, in January, and we need to. The American people need to understand. Whoever is to blame for this, there's probably blame to go around. That Americans can trust on the reliability of the safety and the efficacy of these vaccines. It's amazing that because of Operation Warp Speed, and really I do have to credit President Trump and his administration, Secretary Azar, and the Congress in a bipartisan way for supporting Operation Warp Speed, which made multiple safe and effective vaccines available for distribution in early 2021 in a manner that was 5 times faster than any previous vaccine. It was really a historic feat in medical innovation. And we do need people to adopt it and take it up. I do think in the early days there was criticism of the Trump administration's response to COVID, and so you may have had some people not trust the vaccine safety and efficacy. That was wrong. Dr. Fauci said it was wrong, who was no necessarily a fan of President Trump. At the same time, we hear that Republicans now are more reluctant to take the vaccine. That doesn't make sense either. In fact, it was really a credit to the Trump administration to roll these vaccines out. Biden started on third base. And, we supported $48 billion in the year-end COVID relief package, $48 billion for vaccine distribution. So we need the American people of all political stripes and of all backgrounds to recognize that we need uptake of the vaccine in order to achieve that immunity and get past this terrible virus that originated from China.
Congressman Barr, we're out of time. It's gone quickly. I appreciate the time, though. Thank you very much. And I know we'll catch up in the near future, and we'll talk about some of these issues in a little bit more of a long-form interview. But I appreciate the time. Thank you.
Thanks, Larry.